Dental phobia, dental neglect, fear of the dentist. Do not wait until it's too late or you are too old or it's too hard for you to actually take action and come to see the dentist and take care of yourself. Here is our 91 years old patient, retired, beautiful lady, but presenting with terminal dentition, phobia of the dentist, fractured front teeth, cannot smile, cannot chew, worn dentition, and she presents with a palatal torus, which means she has a lot more bone on the roof of her mouth, and wearing a denture is not an option. A denture will not be a good option for her long term. Taking the radiographs, we can understand in more depth that she definitely has fractured teeth, there is recurrent decay, there is worn dentition, periodontal disease as well, and a lot of missing teeth. She's having a hard time chewing. She cannot chew on the right side, cannot chew on the left side, and even her front teeth have fractured. We totally understand that this is a challenging situation even for anybody else. She is 91 years old, so she presented with a request of receiving dental implants. So we're starting our normal protocol. We take digital scans of her mouth. She presents with a large palatal torus. She's a class 2. That means her lower jaw is much smaller than the upper jaw. And we have worn dentition of fractured teeth. Running her facial photographs to the exocad software, we can design a digital smile design in according to her facial features. So we are presenting the existing situation, upload that into the exocad with the digital smile design software. We are understanding that the lower jaw will have to have some of the bone trimmed. The upper jaw will just going to extract and graft and place a couple of implants. Patient accepting this treatment will follow a couple of surgical procedure. We understand from the software there is going to be a virtual extraction and mandibular alveoloplasty. For the maxillary arch, we will graft and place implants. Retaining some of her existing contours, we build up the diagnostic wax pattern. So the diagnostic wax pattern and the surgical guide will be based on the desired vertical dimension. So this is a full set of virtual teeth. So we're doing a diagnostic wax up virtually. We can translate this into maybe dentures, temporary or immediate dentures, just in case to have it handy. We can 3D print this set of dentures in a situation where the patient will not have good quality bone, or we wanted to let the implants here for a couple of months. And then based on this diagnostic wax up, we can generate the surgical guides, and we can also actually print a denture. Using the 3D printing in-house in our lab, and specifically is a SIGA printer, we can print from a resin, regular, A1 resin, and paint on a little bit of tissue surface. And this can be handy just in case, knowing that the 3D scan shows that the maxillary bone is a little bit deficient, we have the sinus in the ways, and we're going to place immediate implant, which means we take the remaining teeth out, we graft and place maxillary implants. If we take a close look at the CT scan, this is Blue Sky Bioplanning, having uploaded the digital wax up in blue and the existing situation in green, we can understand that we do have some limitations. Patient does not want to undergo sinus grafting, so we have to utilize 4 or 5 implants and plan it accordingly. In her situation, we did place not 4 by 5 implants. I'm usually using a full palatal guide, maintaining all the bone. There's no alveoloplasty on maxillary arch, and there is a pilot drill, pilot sleeve drill, 2mm drill for pilot holes. The rest of it is freehand. Mandibular arch, as we mentioned before, we have to level the bone, extract the remaining teeth, and then we're going to end up with a replacement for the tooth position and the tissue. Running the software, this is again Blue Sky Bioplanning for the surgical plan preparation. We are planning for 4 mandibular implants with alveoloplasty and some bone grafting. existing situation overlaps digital wax up. In the digital wax up, we are planning to advance the mandibular anterior teeth and complete the nicer architecture of the arch, so the mandibular teeth will be in a much better alignment. We do have room for this. From a frontal view and from the occlusal view, the dark green is the digital wax up and the light blue is the existing situation. We were able to prepare a surgical guide. This is a virtual implant planning with 4 mandibular implants, the posterior 2 tilted, the straight up and down anterior implants, and this is a surgical guide prepared and 3D printed in-house. Again, I use pilot drills and 2mm sleeves to guide the first osteotomy. Furthermore, we are also preparing to scan and 3D print in office the surgical set of teeth. So, from the preliminary situation and preliminary smile, we are going to show you how this turned into be a beautiful set of teeth, how this materialized into our first set of surgical teeth, patient wearing a beautiful set of resin 3D printed teeth right after surgery. She has been provided with 5 maxillary implants. We're using this technology, Diametric 4D. It's a most accurate scanner, extraoral scanner in dentistry right now that provides the absolute most accurate location of the implant spatially. And that is converted in-house with our software using the True Abutment library. And that will generate first set of provisional teeth. And here it is, a panoramic radiograph providing us with the first set of provisionals. After a period of healing, we are going to scan again, torque the abutment, scan again, and take a tissue scan. This is the most important moment, allowing for the soft tissue to heal, allowing for the soft tissue to mature, and be able to be stable. In a stable position. It's shrinking, and after a while it's stabilizing. Then what are we doing? We're preparing for the final prototypes and final teeth. So we are running the software one more time, a new digital smile design, an improved smile design, correcting different things that the patient brings, our elderly patients, by their tongue, by their cheeks, by their lips. So we are modifying and improving the prototype design in order to accommodate any of those concerns. Like I said, the upper arch has 5 implants, the lower arch has 4 implants, all on 4, all on 5, and together it's a beautiful set of prototypes. Patient is allowed to wear those prototypes for a couple of weeks, addressing any type of concern: aesthetics, phonetics, function, biting tongue, biting lip, and any other situation, maybe tongue space. They have to regain their tongue freedom and space and be comfortable chewing. Once this is set, we are scanning that and we transfer the information to the lab. The digital smile design is confirmed. We do have a very good harmony within the tooth position and the facial features. And we are going to design the final zirconia monolithic prosthesis. The maxillary arch will be one piece. The mandibular arch will be one piece. Minimal cantilevers, of course. And in this situation, we use conventional mounting. So one way is to use the iCam, iMetric digital workflow, complete digital workflow for the final prosthesis, where sometimes we go analog when we do mount the prosthesis and we cement the tie bases on the master cast. Minimal pink addition, interproximal, and beautiful representation of the soft tissue and hard tissue, pink porcelain and ceramic. Very beautiful work of our ceramist in-house, and attachment of the tie bases on the 4 mandibular implants and the 5 maxillary implants. With this being said, our patient is happily wearing both upper and lower prosthesis. The bite is, of course, readjusted minimally at the final placement appointment. And here is our wonderful patient with a brand new smile. And she's very happy that she can eat and she can enjoy most of her favorite foods. Thanks for watching, and my advice to you is do not wait. Do not wait until it's too late, or maybe it's too hard for you to go through this procedure. We have brave patients, but I think sooner it's better. Thank you for watching.